Hi, my name is Nicole Moxley. I decided to do my case study on the premature infant that was born in 24 weeks and 5 days. Once the baby was in the rescue room, the infant was pretty pale and limp and had no respiratory effort. The heart rate was initially greater than 60 and then dropped severely. Chest compressions were performed on the baby for about a minute. And they were able to intubate the baby after the 4th try. At 6 months of life, the heart rate improved. The infant was able to be transferred to NICU for more tests. At approximately 2 weeks old, the baby had a CT scan or an ultrasonomy, which is a ultrasound. It was performed at 2 weeks, showing that there was a grade 2 hemorrhage on the left side and a grade 4 on the right side of the brain, which left them with the diagnosis of cystic leukemia. So then at approximately 2 months of age, they then did a CT on the baby that showed that the marks had not changed, saying that there was no change in the diagnosis of the baby, that the hemorrhages had not gotten any better, nor had they gotten any worse. So then they decided to do a shunt, which then will increase the baby's chance of survival up to 95% chance. But the first shunt was non-responsive for the baby, so then they had to do another shunt for the baby. They tried to lower the hemorrhages inside of the baby's brain. So then they were able to get the shunt to work, and the baby was able to, it lowered the brain hemorrhages. The baby will forever be diagnosed with CSF, which is where there is fluid on the spinal cord and on the brain. But with the shunt in place, they should be able to maintain how much fluid is around the baby's brain. Hydrocephalus occurs when there is cerebral ventricular system contains excessive amounts of cerebrospinal fluid, and it is dilated because of the increased pressure. This occurs when there is an imbalance between the production and absorption of the CSF. Usually, babies born with CSF do not have a great chance of surviving, but with the shunt in place, it usually increases their chances up to 95%. This newborn will probably have to go to a special school because it will forever have to go through radiology, and it will forever have to be treated for the CSF. Usually the people born with CSF will have to go to a special school, only because normal schools don't have a way that will allow them to miss that much school because of the radiology. The non-surgical treatments for CSF include diuretics and fibrolysis and serial lumbar punctures. They have had a significant amount of complications, and they're less effective than the surgical procedures, but they are there available for those who choose not to do a CSF, choose not to have the surgery. Usually, most people go with the surgery because it's got a greater success rate than the than those other than the non-surgical procedures. Yeah, so